Hello everyone, today we will introduce the letter. Targeting SLC7A11 enhances immune response in HCC ablation. Radiofrequency ablation RFA is widely used in clinical practice as a well-established treatment for hepatocellular carcinoma HCC. RF often results in incomplete ablation of larger tumors, leading to a high risk of tumor recurrence. Dendritic cells disease, as the most effective antigen-presenting cells, serve as a crucial bridge between innate and adaptive immunity. In the TME, disease can capture and process tumor antigens, presenting them to T cells and activating a specific immune response against the tumor. Overexpression of SLC7A11 is associated with poor prognosis in various cancers. Here, we use comprehensive bioinformatics analyses and experimental validations to investigate SLC7A11's role in the liver cancer immune microenvironment, elucidate the underlying regulatory mechanisms, and offer insights on the RFA combination therapy model for HCC. After RFA treatment in patients with liver cancer, the expression of SLC7A11-XCT and the proportion of disease in the TME were significantly increased. SLC7A11-XCT is a poor prognostic marker for liver cancer and is mainly expressed in disease in the TME. Targeting XCT in disease combined with RFA significantly enhances anti-tumor immunity, suppressing tumor growth and offering a promising strategy for improved therapeutic outcomes in liver cancer. We initially explored SLC7A11 expression in immune cells at the single-cell level and showed that the highest proportion of DC in the SLC7A11 plus cell composition, suggesting that SLC7A11 may function in the TME mainly through DC. Through standardized analysis process clustering and subgroup marker gene alignment, we identified 5 DC subgroups, namely CDC1, CDC2, PDC, LCs, and REG. We found that SLC7A11 is highly expressed primarily in REG. We observed the expression of SLC7A11 in the immune cell population and found that the SLC7A11 plus cell composition expression was high, but the proportion of DCs was close to 70%, suggesting that SLC7A11 may mainly play its role in TME through DCs. Through standardized analysis process clustering and subgroup marker gene alignment, we identified 5 DC subgroups, namely CDC1, CDC2, PDC, LCs, and REG. We found that SLC7A11 is highly expressed primarily in REG. Cell communication and module scoring indicate that REG has strong co-stimulatory ability, and the expression of SLC7A11 in REG cells significantly inhibited the expression of co-stimulatory molecules such as CD8 or CD86. To verify the role of XCT in DC, we constructed XCTFL mice and CD11-XCTFL mice and performed in vivo experiments. We simulated in vivo RF ablation with in vitro heat treatment and showed that the heat treatment significantly increased CD8 or CD86 expression of BMDC in XCTFL mice, an effect that was more pronounced in CD11-CCR XCTFL mice. HEPA-1-6 cells were seeded subcutaneously into XCTFL and CD11-XCTFL mice, and local tumors were treated with RFA on day 9, killed and dissected on day 22. Tumor volumes were measured every 3 days, and the strip tumor growth curves were plotted. The results showed that tumor regression was more pronounced in CD11-XCTFL mice than in XCTFL mice after RFA treatment. The results of AG staining and PCNA staining showed the powerful anti-tumor activity of RFA combined with XCT targeting DCs, similar to the results of heat-treated BMDCs. CD86 expression in DCs was significantly increased in the liver cancer tumors of CD11-XCTFL mice treated with RFA. We performed CD8 immunofluorescence staining to compare the differences in CD8 T cell activation. The results showed that RFA significantly activated CD8 T cells in CD11-XCTFL mice, with higher CD8 expression compared to the RFA-only group. Untreated CD11-XCTFL mice and XCTFL mice. Studies revealed that the ratio of DCs to SLC7A11 was upregulated after RFA and that SLC7A11 was mainly expressed in DCs in the microenvironment. Studies have demonstrated that SLC7A11 plays an immunosuppressive role in dendritic cells and may be one of the factors for poor prognosis in HCC. Studies explored the feasibility of targeting SLC7A11 within DC in combination with RFA, provide new insights into the treatment mode of HCC,